Welcome to NSB 104 Leading and Learning. In this group digital presentation, we'll explore the prerequisites of healthcare professionals. In this presentation, the four topics that will be discussed are person-centered care, the key contributors of person-centered care on the prerequisites of healthcare, analysing the leadership challenges for enacting these components in practice, and initiatives in healthcare designed to support person-centered care.
Hi, are you Henry Smith? My name is Alison Williams and I'm your attending registered nurse today. Do you have a preferred name?
I prefer if you call me Mr. Smith.
Okay, Henry. So you're here because of a car accident that you caused with the illicit drugs that you consumed?
Yeah, I had a surgery yesterday.
How are you feeling? Any pain?
Yeah.
No? Okay, I'm going to take your vitals now.
I'm actually in a lot of pain. Yeah.
Wow, you have so many tattoos. Are you in a gang?
Why would you ask me that? I'm telling you, I'm in a lot of pain.
Oh, I don't know. People in gangs covered in tattoos. Anyway, I need to check your blood pressure.
Can you be at least careful?
Sorry about that.
Hi, Aston. Do you need a hand in here?
Can't breathe.
Yes, I definitely have my hands full. Can you just...
No, I got a lot of pain.
That's okay, Henry. Hold on.
Can someone help me, please?
You think a guy with so many tattoos can handle a little bit of pain? For such a tough guy, he sure is a big complainer.
I know, right? One moment, Henry.
I'm in a lot of pain, nurse.
So why is this patient here?
Oh, I heard he was in a hit and run. He was said to be some illicit drugs, and his alcohol level were over the limit.
Really?
Yeah. He got tough because he crashed while trying to turn a corner while speeding.
That's not good. What happened to the other person?
I think they are in the ICU, still in the critical condition. It was his fault. He got hurt anyway.
Yeah, that's so true.
Guys deserved what he got.
Totally deserved it.
Yeah.
I can't breathe, nurse.
Okay, Henry. I need some help in here.
Being a nurse comprises countless roles. They work alongside families and communities, assess and monitor patients, provide personalised healthcare and treatments, and play a dominant part in promoting public health. Nurses are regarded as the front line for a large multidisciplinary and multi-professional healthcare team, and with that comes numerous challenges. Person-centered care is vital in order to establish an effective rapport and therapeutic relationship with patients, as well as to provide quality care which carefully considers the needs of all persons involved. The focus of person-centered care is not a person's illness, but rather the individual themselves, ensuring they are treated with respect, dignity, compassion, and empathy. This approach encourages the full contribution and inclusion of families and patients in their continuing care and recovery. Ensuring health professionals acknowledge patients as equals in developing and monitoring care which is suited to the individual's requirements is a simple yet complex process. Applying person-centered care involves placing patients at the centre of their own care and respecting their individual values. Acknowledging and respecting the patient's personal values, beliefs, attitudes, and life-world experiences. Organising and incorporating relevant care. collaborating to guarantee effective communication and sharing of knowledge by providing information about relevant health concerns and requirements, ensuring the comfort, safety, and emotional support of patients and their loved ones, and in ensuring the involvement of loved ones, which includes family and friends. Placing patients at the centre of their care aims to increase the quality and efficiency of existing services, promote self-directed healthcare, alleviate the pressure health services experience, and improve people's access to care as needed. As a whole, person-centered care, when enacted effectively, is extremely beneficial, as it can positively affect patients and staff. Person-centered care can improve the experience of patients through reducing the rate of readmission, as well as decreasing the length of their stay, improving illness control, and reducing healthcare costs. Staff experience professional fulfillment as a result of providing quality care. Additionally, the professional satisfaction of staff is linked to employee retention for organisations and also decreases healthcare costs. Effective person-centered care can also break down language and cultural barriers, as this framework allows in-depth communication between patients and staff, thus ensuring misunderstandings are prevented. For example, in this case, family involvement and bedside handovers are effective, as they allow patients to communicate their desires and needs to nurses. Finally, healthcare professionals must acknowledge that the patient is not responsible for providing input regarding their care. Rather, it is vital that the staff develop methods to include and support patients to become actively involved in their care. Nurses are placed at the front line of the healthcare system and have a significant impact on the overall productivity of the healthcare system. Due to the close interactions with patients and their families, nurses interpret and understand the requests and hopes of their patients. They are actively involved in decision-making with the clinical team and other healthcare professionals. Research and evidence creates a foundation of care tailored to the individual's primary health concern. The International Council of Nurses defines the role of nursing to be an integral part of the healthcare system. This involves the promotion of healthy living, the prevention of illness, to care for the physically and mentally ill and disabled people of all ages, backgrounds and race in all healthcare and community settings. Nurses have an evidence-based training that empowers them to do work both on their own and in teams alongside other healthcare professionals and throughout the entirety of the health system. Attributes of staff are considered to be the key building blocks of the development of healthcare professionals. These prerequisites focus solely on who can deliver effective person-centered care. Prerequisites of a healthcare professional encompass values such as professional competency, which is the ability to perform tasks or duties, knowledge, professional skills, and the attitudes of a nurse to negotiate care options and efficiently provide holistic care. Developing interpersonal communication, which includes advanced verbal and non-verbal communication and interactions that show empathy and commitment to finding mutual solutions. Commitment to the job, which includes demonstrating responsibility, commitment to not only the job but to patients, families, and communities through international engagement. Clarity to one's own beliefs and values, which involves being aware of the impacts one's own beliefs and values can have on others, and the commitment to reconciling this in ways that facilitate person-centeredness. And finally, knowing one's own self, which involves how the individual makes sense of their own self, being and becoming a person-centered practitioner through reflection, self-awareness, and engagement with others. In order to provide high-quality, person-centered care, there are common leadership challenges which must be identified and overcome. A primary issue within the healthcare system is the excessively managed and ineffectively led services. Firstly, there is a distinct difference between a manager and a leader. Generally speaking, managers have people who work for them, while leaders, on the other hand, have people who follow them. An effective leader must be able to influence and motivate employees, therefore improving their productivity and cohesiveness, resulting in a better outcome for the department and ultimately the public. Effective leaders are able to integrate a range of these styles into their leadership. Furthermore, they are also able to adapt using a style which is best suited to the situation they are presented with. Within the healthcare system, nursing leaders are required to think creatively in a way that allows them to find links between information regarding patients, which may seem inconspicuous or irrelevant. Nurse leaders are fundamental to deliver successful, efficient care, as exceptional care is provided by great leaders, whereas insubstantial care is provided by poor leaders. Innovations in nursing are the thought-out application of a process, product, or procedure designed to significantly benefit not only the individual, but the patient, staff, organisation, and the wider community. As healthcare has increased in complexity and evolves to keep up with advances in medical science and technological growth, nurses have adapted appropriately. And from that, there has been growth in nurse-led innovations. For example, there was a preconception that nurses were handmaidens to the doctors throughout the Victorian era and the 19th centuries. Nurses were also seen as inferior to medicine. Florence Nightingale was a pioneer and advocate for public health and established standards of care. She was the first theorist, researcher, statistician, administrator, educator, visionary, public image, and patient care reform who empowered and inspired others. Nightingale wanted quality and safe patient care throughout the entirety of the healthcare system. Her innovations led to major sanitation, healthcare and policy reforms, and public health funding. With the use of applied statistics, Nightingale was able to forge the basis for a collaborative and dynamic profession that has evolved throughout history. In the 20th century, nursing became a highly skilled and trained profession in the tertiary education. In the earlier years, nursing was a flair for providing comfort to the dying, cleaning of equipment, and straightening of beds. With technical advances, the application of science to medicine and the treatment of the sick over many years has increased demand in the intellectual and technical skills of nurses. What was once solely medical practice became a customary part of the nursing practice. For example, skills such as blood transfusions, medication administration, intravenous therapy, nasogastric intubations, and sterile procedures were once only performed by physicians. With increased responsibility, nurses moved to give patients the utmost level of care.
Hello, Mr. Smith. My name is Alison Williams, and I'm your registered nurse looking after you today. May I call you Mr. Smith, or would you prefer Henry?
Henry is alright.
Okay, Henry. Can you tell me why you're in here today?
I was in an accident yesterday and I just had my surgery.
So how are you feeling today, Henry? Are you experiencing any discomfort or pain?
My chest actually hurts when I breathe.
When you breathe? Okay. So on a scale of 1 to 10, 1 being no pain and 10 being the worst you've ever felt, how would you rate your pain currently?
I would probably say it's a negative.
Hi, Alison. Do you need a hand here?
No, I'm alright. Thanks, Nurse Jessica. Okay, I'm just going to do some respiratory examinations and I'll try and sort out some pain. Okay, Henry, I'm just going to put this oxygen mask on you. And you take deep breaths. I'm going to check the rest of your vital signs. Focus on controlling your breathing for me. I'm just going to take your pulse. How's your pain now? Are you still having difficulty breathing?
No, actually I feel so much better now.
Okay, let me know if you need anything. I'll be back to check on you soon. Thanks, Henry. I'm just going to go talk to your family in the corridor.
Thank you so much.